Hello everyone, Miss Goolsby here. This is chapter 3 we are going to be discussing today. It is infection control, safety, first aid, and personal wellness. This will conclude the final chapter before your first exam that includes chapters 1 through 3. So we will go through this in depth so you have all the information you need. Here are the objectives for this chapter. Demonstrate knowledge of terminology, precautions, procedures, practices, and programs related to infection control, and identify associated agencies with these. Identify key elements of the Occupational Safety and Health Administration, that is OSHA, the Bloodborne Pathogen Standard, and the Needle Stick Safety and Prevention Act, and identify associated agencies with those. Identify general safety lab rules and safety rules that apply while in the patient's room and other areas. Identify hazards, warning symbols, safety rules, and agencies associated with biological, chemical, electrical, fire, and radiation safety, and discuss actions to take if hazardous incidents occur. Recognize symptoms that require first aid and list the main points of the American Heart Association, CPR, and emergency cardiovascular care guidelines. And lastly, demonstrate the role of personal wellness as it relates to nutrition, rest, exercise, stress management, and back protection. We will start out with infection control. First of all, let's define what an infection is. An infection is a condition that results when organisms invade the body, they multiply, and then cause injury or disease. Microbes can include bacteria, fungi, protozoa, and viruses. Most microbes are non-pathogenic. This means they do not cause disease under a normal condition, so most of the ones you come into contact with are not a problem. Microbes that are pathogenic, the word pathogenic means they cause or produce disease. These are called pathogens, okay? So a pathogen is a bacteria, virus, fungi, anything that can cause an actual disease, and that means they are pathogenic. We normally have a lot of non-pathogenic organisms on our skin and other areas like the GI tract. These organisms are referred to as normal flora. Okay, so you need to know that word. Normal flora means those are the good bacteria. So if pathogens get into your body and they multiply, then these organisms, these normal organisms that live there, they help your immune system to try to fight them off. Okay, let's first talk about down there the communicable infections. Communicable infections means they are able to spread from person to person. So you think about all the things that you have heard about that have gone around recently, things like the stomach virus, which could be norovirus or other numerous viruses, or maybe you're talking about the flu or COVID. Then these can be spread from person to person, which means they are communicable. The CDC is charged with investigation and control of disease. This is an agency of the U.S. Department of Health and Human Services. And what they do is they keep track of these areas and anything that is communicable and can have a potential like epidemic potential, then they monitor how many of these infections are out there and where this is going. Like if this is possibly spreading in certain areas more than others. So it's the best to keep our, knowledge of where these infections are. So now the global spread of disease. First, I want to take a minute for you to look at page 75 in your book. I'm sorry, I'm taking a pause for just a second. Okay, the page 75 in your book, the key point It says the National Institute for Occupational Safety and Health, that is NIOSH, which is part of the CDC, that is responsible for conducting research and making recommendations for the prevention of work-related illness and injury. So you need to know about NIOSH. It's one of those agencies that you need to be familiar with. So now let's discuss the global spread of disease. The global spread of disease means that these are communicable diseases that have no geographic boundaries. They can easily become a global threat. This is especially true as more and more people are traveling and going to other countries all over the world. So what starts out as just a little local outbreak, where it's just in your little small area, can quickly spread this way. So disease outbreaks, epidemics that then turn into pandemics and endemics, we've got to be able to define these. So the first word on your slide is endemic. This means that it belongs, this disease, in a particular area, people, or country. And it can be commonly found in that particular area. Okay, that's an endemic. An outbreak is a sudden increase in cases of a disease in an area beyond what is expected or to a new area. So if you don't control an outbreak, it turns into an epidemic. So next we have epidemic. When an outbreak spreads rapidly and it affects people within a community, population, or region, or the number infected in an area is significantly higher than normal, then that is an epidemic. A pandemic. This is when an epidemic has spread over multiple countries or continents and affects a large portion of the population. A perfect example of the disease that spread like this was COVID-19. Near the end of 2019, this started quickly spreading from country to country. So what started out as an outbreak in China became a global pandemic within weeks. So even though they had vaccines and all of that, it kept continuing to rise, and the virus began to mutate into variants that added to the spread and the contagiousness. And so daily, they were having updates on where this was and the numbers. I'm sure you all remember this. But keep those definitions in mind. You have an outbreak that can turn into an epidemic that can then turn into a pandemic. On table 3.1, at the bottom of that slide, it says see table 3.1. These are examples of infectious diseases within global reach. So on that same page 75 where I showed you the key point, table 3.1 talks about some examples of global reach viruses. So the Ebola virus is one. This one was a hemorrhagic virus. It started in West Africa. And this was from direct contact with the blood and body fluids of infected people. Then you have the monkeypox virus. This was first discovered in a lab. And then it was similar to the smallpox virus. And the means of transportation were contact or direct contact with the rash, scabs, or body fluids of somebody that was infected. And then you have the Zika virus. The Zika virus, you may have mild or no symptoms, but you do need to remember the population of people that it affected, and it was unborn babies, okay? So pregnant women were at the highest risk, not the woman, but the baby in her stomach. That was the one that was at risk, the unborn baby, because it could cause severe birth defects like microcephaly in that unborn baby. And it was from the bite of the Aedes mosquito. Okay. Moving along to a couple other definitions. Nosocomial and healthcare-associated infections. You need to know the difference between these words. Nosocomial infection means it is an infection that was acquired in the hospital. They usually say, when they say nosocomial, then they came to the hospital without this infection, but they left with it. And we're going to talk about some examples in a little bit. But then healthcare associated infection means that the patient was infected during their healthcare delivery in any kind of healthcare setting. So nosocomial typically means hospital. Healthcare associated is any healthcare setting. 1 in 31 hospital patients in the U.S. has at least one healthcare associated infection. More than 1 million a year happen that are costing billions of dollars annually. The causes are infected personnel, so there may be somebody that's sick that's working there that then transmits it maybe to a patient. Visitors, it can happen in the form of food, drugs, or equipment, okay? So this can be through people or through things. If you look on page 76 in your book, I do want you to look at the key point. The key point says, according to the CDC, Clostridium difficile, which is, if you've heard of C. diff, this is where C. diff comes in. Clostridium difficile is one of the most common healthcare associated infections in the United States, and it is the leading cause of antibiotic associated diarrhea. Also on that same page, box 3.1, there is a list of the diseases and organisms that are found in healthcare settings. You definitely do not have to memorize this list, but if you're already looking, I want you to look at a couple that should stand out to you. Glancing down this list, you see hepatitis, HIV and AIDS, influenza, methicillin-resistant Staph aureus, norovirus, if you look on down there, Staph aureus, just regular Staph aureus. Then you have vancomycin intermediate Staph aureus, vancomycin-resistant Staph aureus, and vancomycin-resistant enterococci. So let me tell you just briefly about these staphs. Staph aureus was first treated with amoxicillins and penicillins and things like that. Well, it became resistant over time. So then when it became resistant to that family, they then said, well, now we have methicillin-resistant Staph aureus. So it was not treated with any of the cillins. And then now we're seeing resistance in those organisms, so they switched to vancomycin. So then you were treating Staph aureus with vancomycin, and that was topping the methicillin-resistant organisms. And now we are having resistance with vancomycin. And so they're having to use a combination of drugs to get rid of this staph. But that's just, an example of how staph has mutated over time and become resistant to different antibiotics. Okay. These are, if you're looking at this slide number 7, you can see the ones that it says antibiotic resistant infections. You have the well-established ones. These are the ones that are probably the most common that you hear about. C. diff, MRSA, which is methicillin-resistant Staph aureus, and then enterococcus is very common. The multi-drug resistant gram-negatives, this would be like your carbapenem enteros, your E. coli, Klebsiella pneumoniae, Acinetobacter baumannii, and Pseudomonas aeruginosa. These are some that are also becoming resistant to multi-drugs. Okay, let's talk about the chain of infection. It does require a lot of components to be in place for you to get an infection, and that is what is called the actual chain of infection. The chain has to be complete for an infection to occur. If the process of infection is stopped at any link in that chain, then the infection is prevented. But if it successfully enters a susceptible person and causes disease, then that means it can complete the chain. So then that person becomes a new source of infectiousness for that organism, and the process starts over and it continues. Okay, so you've got to have these 3, or actually there's 4 things. There's one on the next slide. Number 1 is the infectious agent. This is called the causative agent. Okay, so this is the pathogen. So you got to have something that's actually causing it. That's whatever pathogenic microbe it is that is causing the infection. Second, you've got to have a reservoir. This is the source of the infectious agent. Okay, this is the place where the microbe can survive, grow, and multiply. This is where it goes to live. Okay, then once it gets there, you've got to have an exit pathway. Oh, let me back up for a second. Most humans are what we call the reservoir host. So that's where we are in this chain. We are the reservoir, okay? We're the place where that is going. So then you have the exit pathway. This is a way for that infectious agent to leave us, whoever is being infected. Why does it want to leave us? Well, so that it can go infect more people. Okay, that's why it's leaving, to go get into somebody else. So how can it leave us? It can leave through secretions in our eyes, our nose, our mouth. If it is a wound, it can leave by way of exudates from these wounds, tissues, blood from a venipuncture, that's where we come into play, skin puncture sites, and even feces and urine. So it can leave by any of those ways through us. Then we know how it can leave. Now we need to know number 4, the means of transmission. Well, how does it get out of there? First, you have airborne. Then these airborne transmission particles, they disperse through the air, and they can remain infective for a long period of time, and then somebody else can inhale them. So like these little droplets can then be inhaled by somebody else. And this can happen by way of sneezing, coughing, just talking can sometimes spread this. And then once they're stuck in the air or the dust particles, somebody else comes through, they inhale them. If that person is susceptible, let's say that you sneeze in the elevator and then you walk out and immediately somebody else walks in. Well, your infectious particles, if you are sick, are suspended in the air. So when that next person walks in, they may not have actually been in contact with you at all, but they just walk in after you. Then they can still inhale these infectious particles and not be anywhere near you because these are airborne. And then that's how you get this infection. So airborne infections can be stopped by those N95 masks that they had us to wear during COVID. These are NIOSH, National Institute for Occupational Safety and Health. They certified these N95s, and these are, the ones that protect you from airborne. Okay, then you also have higher level ones of those that were for healthcare personnel, and these are considered respirators that you wear to go into rooms where you have highly infectious individuals. Okay, contact is another way of transmission. You do need to know that contact is the most common means of transmitting infections. You have 2 ways: direct contact, which is physical contact. This is close or intimate contact like touching or kissing. Then you have indirect, where the host touches contaminated objects such as the patient bed linens, clothing, dressings like their wounds, and even their eating utensils. So this means, like with us, it includes contact with phlebotomy equipment like gloves, needles, specimen tubes, testing equipment, and the trays we use. So it can also be things that maybe we're not even thinking about, some of these inanimate objects like countertops, computer keyboards, phones, pens that people have used in front of you, pencils, doorknobs, faucet handles. All of these things can harbor infectious particles. You need to know what those infectious particles are called. It is a fomite, F-O-M-I-T-E. A fomite is an inanimate object that can transfer an infectious particle. Okay, so that means it indirectly infects us because that inanimate object contains those infectious particles. Okay, then you have droplet. Droplet means that this is coming from the mouth, nose, or the eyes of a susceptible individual. It's going there. What happens is these droplets are generated from somebody that's infected. They cough, sneeze, or talk. It has to get into us through our eyes, our mouth, or our nose. Okay, airborne and droplet are sometimes confused, so you need to know the difference. Droplet differs from airborne because droplets travel less than 10 feet and they do not remain suspended in air. Droplets travel less than 10 feet and don't suspend in air. Airborne continue to float through the air and can be inhaled after that infectious person who sneezed or coughed left the area. So when you think about airborne, think about that example of coughing or sneezing in the elevator, somebody being gone, somebody else walking in. Okay, that's an airborne type. It's suspended in the air. You don't have to be right next to them. Droplet can only go about 10 feet and then that's it. It's not there when that person leaves the area. Okay, another way is by vector contamination. A vector is meaning that it is carried by an insect, arthropod, or an animal. You need to know one of the main examples that people talk about still, and that is West Nile virus. West Nile is transmitted by mosquitoes. Also, another example is the bubonic plague, which you don't hear about anymore, but the organism is Yersinia pestis, and it was transmitted by rat fleas. Okay, another kind of transmission is vehicles. Vehicles are not in the way that you think. They're not cars. These are going to be contaminated food, water, or drugs. So an example of a vehicle transmission that's a really good one is salmonella. Salmonella you get from handling contaminated chicken. And then Shigella, you hear about salmonella and Shigella. There are two pathogenic organisms that run rampant. Shigella you get from, one of the main ways is drinking contaminated water. So salmonella and Shigella. Salmonella from your chickens or even raw eggs. This is why they say don't eat cake batter or cookie dough because of that. Okay. Number 5, you have to have an entry pathway. So now we've talked about the infectious person. It got in the infectious person, it spread, now it's out of the infectious person. Now we have to have an entry pathway to enter the susceptible host. So this means mostly any kind of body orifice or opening. Okay, this is how it gets inside of the other person. Mucous membranes of the eyes, nose, or mouth, or if you have a break in your skin, this is why we wear gloves. Just in case you have any kind of break in your skin. Now, one thing I will tell you is if you have a cut that you know is on your skin, then you need to put a Band-Aid on it first and then put your gloves on. That way you're double protecting that break in the skin area in case your gloves get a hole for some reason. Okay, let's talk about a susceptible host. So in the susceptible host, this means that you've got to have somebody that has a decreased ability to fight off the infection. So maybe they have a decreased immune system at the moment. So some things that affect people being able to get sick easier are their age, their health, and their immune status. So an example of that would be newborns are way more susceptible to infection because when they come out, they have their mom's immune system for a short time, but then they don't have any. Okay, that wears off and they don't have any. So then they're way more susceptible to somebody like us. So they're still forming it. Also, when you get older, then your immune system starts to fade. Okay, so that means young babies, they're more susceptible, and elderly, they're more susceptible because of their weakened immune system. If you have a disease or you're on antibiotics for some other reason, or you're taking immunosuppressive drugs like steroids, or maybe you've had surgery or anesthesia, or you have a catheter, all of those can leave you more susceptible to getting an infection. Okay, this slide shows the complete chain of infection. So do you see where let's just start up there at the very top. You've got the infectious agent, so that's what's causing the problem. Then you've got the reservoir, where it's coming from. This is the animal. In this case, it would be, let's say we're sick, this would be us. Then you've got to have a way for it to get out of the body, so that's the exit pathway. Well, then you've got to say, well, now we know how it can get out, but how does it go? Then you've got to have the means of transmission. Then you've got to go to somebody else. So let's find another person. Let's get an entryway into that new person. Then where is that new person? Well, they have to be susceptible. So then that susceptible person, then there goes the organism. So then it starts the pathway over. So make sure you know this chain of infection. Well, how do we break this chain of infection? We break it by stopping at the source, or preventing the contact with the substances from the exit pathway, or maybe we eliminate their transmission, or we block their exposure to the other entry pathways, or we reduce the susceptibility of the potential host. So, how do we do this? Well, we do this by hand hygiene. Okay, so we have to have effective hand hygiene. This is why you wash your hands going into the patient's room. You wash your hands going out. You also sanitize going into the next room. As a healthcare worker, our jobs are strenuous. We are there long hours and sometimes on little sleep. So what can we do to help our immune system, to help break the chain from us getting sick? We can have good nutrition, we can get the best rest that we can possibly get, and we can try to reduce our stress. Other ways are we follow the isolation procedures of the hospital. So if your patient has a sign on their door, you make sure that you read the signs, because maybe you don't need to go in there without extra protection. We also immunize against common pathogens. Most hospitals require you to get the flu shot annually. We have proper decontamination of surfaces and instruments, so we're going to keep our our trays that we take to patients' rooms, or our carts. Make sure we clean those off at the shift times. Proper disposal of sharps and infectious waste, so when we get into the sticking, you're going to make sure that you throw everything away. Nothing ever sits down. You make sure you always wear your gloves and your lab coat or anything else that might be protective equipment. You use needle safety devices when drawing blood, so that when you stick the patient, as soon as the needle comes out of their arm, you automatically enact that safety protocol that's on that needle, and it makes it safer to use, safer to throw away, so you're not walking around with a needle that is wide open. Okay, your healthcare institution, the way they can break the chain is they have their own, that hospital has its own infection control program. Also, they have isolation procedures. They have infection control practices. They also have insect and rodent control to keep from passing anything like that. Some of the infection control programs, what is the purpose of that? Well, if you have an infection control program, that means that Joint Commission requires every single healthcare institution to have one. So this means you're being responsible for protecting patients, the employees, the visitors, and anybody that does business with that hospital. Okay, any others that fall into that chain. So a typical infection control program means that they break the chain of infection. They monitor and collect data on all infections that happen within the institution, and they institute special precautions in the event of outbreaks of specific infections. The components. How do we do this? Well, they have employee screening programs. This means that they have screening tests to determine if they have or have been exposed to certain infectious diseases. Employee screening tests are something like the TB skin test that you had to do to get into this program. Okay, this is a test to screen to see if you have TB or you've been exposed. So employees with a positive TB skin test, then what's the next step there? Then they get a chest x-ray. So the chest x-ray also is a screen to see if they have anything in their lungs that would lead to them having an actual TB case, or have they ever been exposed? Some other screening tests are maybe some kinds of diarrhea and skin disease infections that are out there. Let's talk about employee immunization. Immunization is another word for vaccination. So some of the vaccinations that they require you to have, when COVID first started and they came up with the vaccine, the hospitals required you to have that 2-dose series and also a booster shot every 6 months of COVID-19. Now some hospitals have changed their protocol, so all of this will depend on where you go to work. But the hepatitis B vaccination that you guys had to get into this program, if you didn't already have it, that one everybody requires. That is a 3-dose series. Usually you get the first dose nowadays right about, like, say, but you get it at birth typically. The second dose is about a month after the first dose, and then the third dose is about 5 to 6 months after that second dose. Okay, so then that is your 3-dose series. Influenza, that's another one. You get the flu shot annually. MMR, that is measles, mumps, rubella. You get 2 doses of MMR, 1 dose, and then 28 days later you get the next dose. Meningococcal, that's another one. That would be 1 dose, and then you got to see if your hospital does require this. Most don't. Tdap, that one is 1 dose, if not previously vaccinated, and then you get the Tdap booster every 10 years after the first dose. So if you are looking at your vaccination shots, you can look to see if you've had one within 10 years. If you have not, then you need to go get a new Tdap shot. Varicella or chickenpox, if you get the vaccination for that, it's 2 doses, 4 weeks apart. Okay, employee immunizations, that's all for that. Let's talk about evaluation and treatment. OSHA mandated confidential medical evaluation, treatment, counseling, and follow-up of anybody that has been exposed to bloodborne pathogens. So to be able to do that, they have surveillance. Surveillance is another way to actually monitor these infectious diseases. This involves watching patients and employees that are at risk of acquiring infections, as well as collecting, evaluating, and distributing this data that is on these patients and these employees. So they have to keep up with this information and see how it's spreading or where it's going or how they can prevent it in the future. Okay, infection control practices. Let's move on to these. It seems like there was, on page, I want you to look on page 84 in your textbook. This is a picture of standard precautions. This is a picture of the standard precaution sign. And this is where you have to see that you assume every single person that you come into contact with is potentially infectious or colonized. So if you are pretending like every person that you are going to stick is potentially infectious, then these are the things that you need to always do to prevent this infection. First is hand hygiene. So you're going to avoid touching any surfaces that are in close proximity to the patient unless you absolutely have to. When your hands are visibly dirty, that means you can see something on them, then you can't do anything but wash with soap and water. If they're not visibly dirty, like you don't see anything on them, then that means that's the case where you can use the alcohol-based antiseptic hand cleaners. These will be usually on the walls in the patient's room in the hallways. You can use these if you don't see anything on your hands, okay? But if you do, then you actually have to use soap and water. So when do we do this? Well, we do it before we have contact with the patient, after we have contact with the patient, because remember, we're pretending that everybody that we come into contact with is infectious. And then we do it after we have contact with any kind of object like medical equipment that was in that patient's area that maybe we accidentally touched after we've already washed our hands. After we touched the patient and we washed our hands. Let's say, let me go back and get this. If you pick up something else that's touched the patient, then you're going to need to wash your hands again. And also after removing your gloves, but that should have already happened when you take off your gloves from touching the patient. So you say, well, are the gloves not protecting me? Yes, they are, but you still want to be double protective, okay? Let's talk about PPE. You need to know what that stands for. That is personal protective equipment. This is anything that you can wear to protect yourself when being around patients. Gloves, gowns and or lab coats, those are two non-negotiables. You need gloves and lab coats all the time. Now, the masks, face shield, goggles, and respirators, those are all optional depending on what patient's room you're going in or what you're doing to stick. Let's talk about how do we put gloves on and off. Okay, glove removal. Glove use does not replace the need for hand hygiene. That's what I just got through saying. So as soon as you take them off, then you're going to wash your hands. But look at the steps. Do you see how they take and pinch it at the bottom? And you inside out that glove on that one hand? Then what do? They take their fingers and go up underneath the other hand, and you inside out that glove. So what you end up touching is the inside of the gloves that never touched anybody except your skin. Okay, so you inside out them to do that. All right, let's talk about, this slide is a picture of the N95 respirator. This is the mask that was actually one of the COVID masks. They had this before COVID, by the way, but that was for like TB and things like that. But during COVID, this mask became known to everyone. Let's talk about why we would need that mask. Look on page 85 in your textbook. This is your respiratory hygiene cough etiquette. We just talked about how things spread, airborne and droplet. So, respiratory hygiene and cough etiquette. If you are sick, if you're running fever, you shouldn't be there, okay? But let's say you are getting over your sickness, you're not running fever, you decided to come to work. Then cover your nose and mouth when coughing or sneezing. Use a tissue for any secretions you get. Throw away the tissues. That should be common sense, but you would not believe how many people lay their tissue down. Use proper hand hygiene after contact with those objects, like wash your hands. Use an antiseptic, hand wash, something. Always wash your hands off though. Masks. Offer masks to people who are coughing, Mask with the ear loops or ties, these are helping to contain your respiratory secretions. Those would be something like the N95 mask, or you have the regular little plain paper mask, but you can get more specialized with the N95. If anybody is coughing, have them to sit at least 3 feet away from others, or you sit 3 feet away from others to try to reduce that risk. Droplet precautions. In addition to standard precautions, and in addition to assuming everybody is infectious, anytime you see a patient that has symptoms of a respiratory infection, be aware that they may possibly be very contagious. So you need to be careful when you are around them. Okay, looking at these charts, these are not something that you have to memorize. Okay, look at the order for putting on and taking off PPE. Okay, so donning and doffing is how they say it. So donning means putting it on. Doffing means taking it off. Okay, so donning is putting it on. So to put on our PPE, you need to memorize the order. It goes gown first. Then if you are wearing a mask or a respirator, then put the mask or respirator on. Then put your goggles or face shield, and lastly put on your gloves. Okay, let's say we go into the patient's room after that. Then we are going to doff or take off all of this PPE. So this is the order. You do it in almost the opposite order, okay? Not exactly. Gloves first, then the goggles or the face shield, then the mask, and then then the gown, then the mask. Mask is where it's last, because then you only grab the strings around your ears and throw it away. Then you wash your hands and leave. So putting it on, gown, mask or respirator, goggles or face shield, gloves. How do we take it off? Gloves first, then goggles or face shield, then gown, then mask last. Touch the strings only around the ears and wash your hands afterwards. Okay, let's talk about a couple of definitions with infection control. Asepsis is the first one. This is the condition of being free of contamination or germs that could cause disease. So if you are not sick at all, have not been sick, you are in asepsis. Aseptic, free of disease-causing microbes. Okay, so aseptic technique then would be using or reducing the chance of microbial contamination. So as far as aseptic technique for us, this means we are reducing the chance of contamination by protecting our patients from infection, from preventing this, whatever is going on, to be able to spread any further. So an example of that for phlebotomy is opening a sterile package in a way that keeps the item from being contaminated before it's being used. So if you're opening up a butterfly needle, you're not going to open up the needle and lay it on the patient's bed. Okay, we are going to open it up and leave the package where you can get to it, but not lay it down where it can get contaminated anywhere. Okay, proper hand hygiene is another aseptic technique. Keep supplies within easy reach to avoid dropping them. I already said the open packages. Prompt and safe disposal of contaminated equipment. So once you've stuck the patient, throwing all of your supplies away. Prompt cleanup of infectious material. Let's say there's drops of blood that go somewhere. Clean those up properly. Wearing gloves for blood collection and other PPE when indicated. Okay, so always wear your gloves and your lab coat. NICU infectious control techniques. Okay, the NICU is your neonatal nurseries. Okay, these are your newborns. These are the ones, besides the elderly, that are most susceptible to infectious. Okay, so what are we going to do? We're going to start out the same. Wash our hands and put on our gloves. Gather only the supplies we need to perform the specimen. Do not roll the carts around that are potentially infectious in there up near the babies. Leave the trays outside the room or outside the nursery. Remove our gloves, decontaminate our hands, and put on new gloves in between babies. But now you're still going to do that in between patients too. All right, isolation procedures overview. Keep your patients with communicable infections separate from others. Prevent the spread of infection. Protect patients with compromised immune systems. Isolation requires a doctor's order. You can't put someone in isolation, a patient isolation, only a doctor can do that. And the infected patient is confined to a private room. Look at that blue box on that slide, which is very important. Scrubs or pants that touch the floor can pick up infectious material. So CLSI, which make the lab standards, say pants worn by lab personnel should be 1 to 1.5 inches off the floor to prevent contamination. So not only are you dragging the floor with those pants and taking it home with you, but you're dragging it from patient room to patient room and potentially infecting the areas. So please make sure that you get the right length on your lab pants, okay, on the scrubs you buy. Do not get scrubs that are too long, because not only does that not look good, but that is also a potential cause of infection. Okay, isolation procedures. Let's talk about these a minute. I'm looking, there is a page in your book. They used to have a chart in this book, and I don't see the chart anymore. So you have to learn these different isolation procedures. If it says protective or reverse, that is for your patients that are highly susceptible to infections. So most of the time when a patient has isolation procedures on their door, that is to protect you, the healthcare personnel. But if this one is on the door, which means reverse protective, that means you're protecting the patients against you. So who might be an example of a set of patients that need protecting? One set that should come to mind would be cancer patients or patients that are on the oncology floor. These would be patients that do need protecting. So if you have a cold or you have fever of any kind for any reason, then you do not need to go in these patients' rooms, because they don't need to risk getting infected by anything. Okay, universal precautions. We all do this with everybody. This means we act like the blood and body fluid of every single person is potentially infectious. That means even if it's our mother, our child, our sister, whoever it is, even if we know whose sample it is, we're going to pretend that every single sample we come into contact with is potentially infectious. And that is universal precautions. Body substance isolation. This means we are going to use gloves. This goes beyond universal precautions, okay? So this means not only are we going to pretend that every single person is potentially infectious, that means we are going to always use gloves even if we have to touch anywhere on them. So contacting moist body substances, okay? We're always going to suit up and wear our PPE. Standard precautions. This should be used for all patients, like I just said and stressed, even if it's your sister, your mother, your child, any of them, all patients. It is the number one strategy for control of nosocomial, or like I said earlier, hospital-acquired infections. It covers blood, but not only blood, all body fluids, skin breaks, mucous membranes, and it has been updated to add respiratory hygiene and cough etiquette. Okay, transmission-based precautions. These are used for patients who are known or suspected to have certain infections. So there may be an airborne precaution that is on that patient. That means they may have an airborne infection. Droplet precautions, you already know what that means. And contact precautions means they may have, say, an example would be like MRSA or methicillin-resistant Staph aureus. So you would need special precautions to go into their room. Oh, let me back up 1 second. I forgot to say, well, it won't let me back up, but I forgot to say like an airborne precaution would be like a TB patient, tuberculosis. Okay, this symbol, you need to recognize this as being a biohazard symbol. This means that any material or substance that is potentially harmful to the health can go into a bag or a sharp container that has this biohazard label on it. So that means that those things in that bag or that sharp container are potentially infectious to other people because it has blood or body fluids in it. Now, biohazard exposure routes. Airborne, we've already talked about. Ingestion, this means that you don't want to eat food or chew gum or pick up gum or eat candy or smoke a cigarette. Any of this stuff without decontaminating your area, and don't do it in the lab for sure. Non-intact skin. This means that biohazards can enter the body through visible and even invisible breaks in the skin. So like abrasions, burns, cuts, scratches, sores, even dermatitis and chapped skin. So this is why we wear gloves. Percutaneous. Percutaneous means through the skin. This means through intact, unbroken skin from accidental needle sticks and injuries from other sharps. It can be broken glass or even specimen tubes. Permucosal, this means through the mucous membranes. This could be the nose, the mouth, and even the eyes, where droplets can be sneezing, coughing, splashes or aerosols, or rubbing or touching your eyes, mouth, or nose with your contaminated hands. So don't take off your gloves and then scratch your eyes after that before you've washed your hands. Bloodborne pathogens. This means this is applied to any infectious organism present in the blood and other body fluids and tissues. Even if there's no symptoms of disease, the most significant biohazards fall into this category. Hepatitis B, this one is one of the most common bloodborne pathogens. Hepatitis D is another one. Just to give you a little bit of knowledge about these hepatitises, you cannot have hepatitis D without already having an infection to hepatitis B. So these are roommates, okay? They go together. You can have B by itself, but you cannot have D by itself. So the best defense is to get the hepatitis B vaccination, which is that set of 3, which you had to get into the program, so you're set. So if you prevent B, then you'll never have to worry about D, because you can't have D without B. Okay, hepatitis B exposure hazards means it's present in blood and other body fluids of infected people. It can survive up to a week on objects, and it can be transmitted through needle sticks and sexual contact. Symptoms of hepatitis B that you need to be familiar with are flu-like, fatigue, loss of appetite, mild fever, muscle joint, abdominal pain, nausea, vomiting. The list can go on a little further. You can feel horrendous. Okay, hepatitis C. This is another one. This has become the most widespread chronic bloodborne illness in the United States. There is no vaccine currently available for hepatitis C, though. Okay, so keep that in mind. It is present in blood and the serum and sometimes saliva. Infection primarily occurs after large or multiple exposures. You will see this in needle sharing, like illegal drug needle sharing. It's transmitted through needle sticks or sexual contact. Symptoms are flu-like, fatigue, loss of appetite, mild fever, muscle joint, abdominal pain, nausea, diarrhea. Something else to keep in mind about hepatitis C is that it is the leading cause of liver transplantation. HIV. This is another bloodborne pathogen. It attacks the body's immune system and can eventually cause AIDS, which is acquired immunodeficiency syndrome. So it starts out with human immunodeficiency virus, which is HIV, and then it turns into AIDS. So exposure hazards. It is present in blood, semen, saliva, tears, urine, spinal fluid, amniotic fluid, breast milk, cervical secretions, and tissues. What is the risk for us? Primarily through exposure to blood. Symptoms of HIV. It progresses through a mild to severe flu-like symptoms, then hairy leukoplakia, white lesions on the tongue, turns into Kaposi sarcoma, and then you can even have neurological symptoms further along and dementia. OSHA Bloodborne Pathogen Standard. This is enforced by federal law. It is intended to reduce or eliminate bloodborne pathogen exposure. It does require engineering and work practice controls to prevent these exposure incidents. The availability and use of PPE or protective equipment. It does require special training to use this equipment. Medical surveillance, and also HBV, your hepatitis B vaccination for all at-risk personnel. So if you come to the hospital working and you did not get your Hep B vaccination, then they have to provide that for you. Needle Stick Safety and Prevention Act. This is required by OSHA to revise what we just talked about, the bloodborne pathogen standard, in 4 areas. Revision and updating of the exposure control plan, solicitation of employees' input in selecting the engineering and work practice controls, modifying the engineering definition, and new record-keeping requirement, which includes the requirement to keep a sharp injury log, like logs that happen from the sharps containers or the sharps, anything that goes into the sharps. Okay, exposure control plan. It must be written, reviewed, and updated annually. Non-managerial employees with risk of exposure must be involved in this identification, review, and selection. Bloodborne pathogen exposure routes. Skin. It can be pierced by contaminated needles or sharp objects. Blood or other body fluid splashes in the eyes, nose, and mouth. Blood or body fluid contacts through cuts, scratches, or abrasions. And a human bite, which breaks the skin. The exposure incident procedure. So, if you get stuck, let's say, by a needle or sharp, then you carefully remove the shards of glass or the needle from the area. Wash the site with soap and water for at least 30 seconds. If it was a mucous membrane exposure, Then you flush the site with water or sterile saline for at least 10 minutes. Let's say you get a splash in the eye. Use the eye wash station if it's available to flush the eyes. Remove your contact lenses ASAP because that's not going to protect you. And in fact, it's going to, if you got something in your eye, it could get behind the contact and even not allow you to wash it out and be a problem. Report the incident immediately to the supervisor. Report directly to the provider for evaluation, treatment, and counseling, like wherever the supervisor tells you to go to do the evaluation, treatment, and counseling. Surface decontamination. All surfaces in specimen collection and processing areas, you must decontaminate them with a 1 to 10 bleach solution or other EPA-approved solution. Cleanup of body fluid spills. It must be an EPA-approved chemical solution and kit. Gloves have to be worn and absorb the material without spreading it over the wider area. Biohazard waste disposal. All reusable items contaminated with blood or body fluids go into the biohazard waste containers. Chemical safety. General rules. Always wear PPE and always clean up chemical spills properly. Never store chemicals above eye level. Never add water to acid. In fact, it's the opposite. If you're ever pouring it, you always add acid to water. The reason being, if something is going to splash out, it's going to be what is already in the container that splashes out. That is why you add the acid to the water, so if anything splashes out, it's the water, not the acid. So that's why you never add water to acid, because what will splash out will be the acid. Never store the chemicals in unlabeled containers. Always make sure they're labeled. Never pour chemicals into dirty containers. You don't know what's in there and what might react. Never use chemicals in unintended ways. So if you don't have a reason to use that chemical, don't. OSHA Hazard Communication Standard. This means it requires labels to be properly done. It has to have a statement of warning, which is a danger or a poison if it is dangerous. Statement of hazard, which means it's toxic, flammable, or combustible. Precautions to eliminate risk. And you have to know first aid requirements if you spill or have any kind of exposure. So this requires the lab to have SDSs, which are standard safety data sheets. These have just general, precautionary, and even emergency info on every single chemical in the lab. Okay, this is a picture of a DOT hazardous material label example. And to look at this in your book, it is on page 108 in your textbook. This is the same picture. So on this 314, this slide, you can see that it has a picture of a fire. So what does that mean? That means that it is flammable. It also has a 4-digit hazard identification number. It has a colored background on that bottom, and it has a class number, okay, of what it falls into. Okay, National Fire Protection Agency labeling system. This is what we call NAFPA. NAFPA requires every single chemical to have a label similar to this on it. And what this is doing is you've got numbers in all of the boxes. So the blue box indicates health hazards. So it's numbered from 0 to 4. You may want to jot that down, 0 to 4. 4 is the highest it can go. So this particular example has a 2 in it. And if you go to page 109 in your textbook, it gives you an example of what each of these numbers would mean in that category. So for example, number 2 in the blue says that this has materials that on intense or continued exposure could cause temporary incapacitation or possible residual injury unless prompt medical treatment is given. In the red box, this is how flammable your material is. This one is number 4. It can only go from 0 to 4, so 4 is the highest. That means if you look at your chart, it will rapidly or completely vaporize at atmospheric pressure and normal ambient temperature, or it is readily dispersed in air and that it burns readily. Number 3 is how reactive it is, or the box that has the 3 in it, is the yellow box. Yellow means how reactive it is. This one has a 3 in it. So if you look on the chart, materials that in themselves are capable of detonation or explosive reaction but require a strong initiating source, or that must be heated under confinement before initiation, or that react explosively with water. So, maybe this one reacts explosively with water, because look at the white box. That white box is anything else you might want to say about it. And look at what it has in it. It has the W with the line. That means it is reactive with water. And then the other one is your radiation symbol. That means it is radioactive. This is the picture of the chart that I was talking about that is on page 109 in your textbook that tells you what each of these numbers mean. You don't have to memorize what each of these numbers mean, but I want you to be able to know, if you ever see this, you will know that this matches up with what each box is telling you: the health hazard, flammable, radioactive, or the reactive, Okay. Safety showers and eye wash stations. Phlebotomists should know their location. Like in the lab, you need to know where it is. It's used for chemical spills or splashes to the eyes or the body. You're going to flush the affected part of your body with water for at least 15 minutes and then visit the ER for evaluation. That is a picture of a chemical spill cleanup kit, okay, that you can use to clean up any kind of chemical, or maybe it's a body fluid type spill. Body fluids are usually a different color though. Okay, electrical safety. What do we do if we have electrical shock? Shut off the source of electricity. If you can't shut it off, use a non-conducting item to remove the electricity source from the victim if they're being shocked. Call for medical assistance, start CPR if needed, and keep the victim warm. Fire safety. There are procedures to follow in case of fire in your lab. You should know these before you start work. Know the location of the fire extinguishers and how to use them. Know the location of fire blankets or heavy towels and how to use those. And the location of emergency exits and evacuation routes. Components to start a fire. You need fuel, heat, oxygen, and a reaction. So fuel is a combustible material. Heat is the temperature of the material until ignition. Oxygen helps maintain that combustion. And then the chemical reaction is what produces fire. You have to keep these components apart to prevent fire, but they all go together to start a fire. This is a picture of the fire tetrahedron. So you can see the fuel, the oxygen, and the heat. Forms like a little invisible triangle where the fire occurs. Okay, classes of fire. You do need to know these classes of fire. Class A is regular combustible materials like wood and paper. It requires water or water-based solutions to extinguish this fire. Class B is flammable liquids and vapors like paints, oil, grease, and gasoline. This requires blocking the oxygen or smothering to extinguish it. Class C is electrical equipment. It requires non-conducting agents to extinguish it. Class D is combustive or reactive metals like sodium, potassium, magnesium, and lithium. This requires dry powder agents or sand to extinguish. Class K is high-temperature cooking oils, grease, or fats. This requires agents that prevent splashing and cool and smother the fire. This is a picture of your radiation hazard symbol. You do need to know what this looks like. The principles of radiation exposure are distance, shielding, and time. How long are you in there? Radiation is present in patients injected with radioactive dyes. So your patient would be a case of radioactivity. Specimens that come from radiology or nuclear medicine, and the radioimmunoassay of the lab. So these are three areas where you may not think that you would be in contact with radioactivity. External hemorrhage. This is abnormal or profuse bleeding. How do we treat it? Firm direct pressure to the wound using cloth or a gauze. Of course, we have gloves on before this starts. An elastic bandage can be used to hold the compress in place, and only use a tourniquet as a last resort. Shock. This occurs when insufficient return of blood to the heart results in inadequate oxygen supply to the body organs and tissues. How does this occur? Hemorrhage, heart attack, trauma, and drug reactions. What are the symptoms of someone in shock? Pale, cold, clammy skin, rapid, weak pulse, increased shallow breathing rate, an expressionless face and staring eyes. What is the first aid for shock? Maintain an open airway for the victim, call for emergency assistance, keep the victim lying down, elevate their legs so that the head is lower than the body unless doing so would cause further pain or injury to the patient. Attempt to control bleeding or other causes of shock. Keep the victim warm until help arrives. Look at the caution. Do not give fluids if the patient is unconscious, semi-conscious, or has injuries likely to require surgery and anesthesia. And don't move the patient unless it is necessary to avoid imminent danger. You may cause more harm than good. Stroke. This is a leading cause of death and serious disability in adults. It is best if diagnosed within 3 hours of symptom onset so that they can have TPA, which is called the clot buster. The signs of a stroke are sudden numbness or weakness in the face, arm, or leg, especially just if it's on one side of the body. Sudden confusion or trouble speaking or understanding speech. Sudden trouble seeing in one or both eyes. Sudden trouble walking or dizziness or loss of balance or coordination. A sudden severe headache with no known cause. Look at this memory jogger for warning signs of a stroke. It is fast. Face drooping, arm weakness, speech difficulty, and time to call 911. Because remember, the best chance of them recovering is if they can get that TPA within 3 hours. Okay, CPR and emergency cardiovascular care. The American Heart Association recommended training for healthcare professionals. This is where you get the American Heart CPR. It is a 6 to 8 hour BLS course. It includes CPR, the use of AED, removing airway obstruction. Your certification in this is good for 2 years. You also have guidelines where you can have hands-only CPR for just lay rescuers. Trained rescuers still provide compressions and rescue breaths, but you have to start it before you're opening the airway. Like if you start compressions, rescue breathing, you have ABCs of CPR. This has been replaced with what we call CAB. Instead of ABC, it's CAB. It is compression airway breathing. So instead of the ABCs, the airway breathing compressions, you do compressions first, then airway, then breathing. Okay, on an adult, you need to know the compression rate is 100 to 120 beats per minute. Compression to ventilation ratio is 30 compressions to 2 breaths. So this would be each breath needs to last for 1 second. Each breath also needs to cause the chest to rise. So as you're breathing into the patient's mouth, you're watching their chest rise. The compression depth is at least 5 centimeters or 2 inches, no greater than 6 centimeters or 2.4 inches. Performing the chest compression so that the chest compression and recoil or relaxation are about equal. You have to allow full recoil after each compression without leaning on the chest. You want to maximize the number of compressions per minute by minimizing the frequency and duration of interruptions in the compressions. If it is an infant or child, CPR begins with 30 compressions if it's a single rescuer, 15 compressions if it is 2 healthcare workers. The compression rate is 100 to 120 per minute. Both compressions and rescue breaths if possible. If not, do compressions only. The compression to ventilation ratio is 30 to 2 if it is 1 person or 15 to 2 if it is 2. Compression depth is at least 1/3 the anterior-posterior diameter of the chest, or approximately 4 centimeters or 1.5 inches in infants, and approximately 5 centimeters or 2 inches in children up to the onset of puberty. You allow complete chest re-expansion after each compression and a brief rhythm check every 2 minutes. If it is hands-only CPR, before starting CPR, look for signs of normal breathing, tap them on the shoulder and ask them, "Are you okay?" If no response, no pulse, and no breathing, start CPR. There are 2 basic steps. Call 911 and then push. Push means push hard and fast in the center of the chest. Look at the box. The beat of the Bee Gees song, "Staying Alive," or the Queen song, "Another One Bites the Dust." This provides the ideal rhythm for performing compressions, only CPR, like doing the compressions only. So you're going to be singing "Staying Alive" as you're pumping their chest. That gets you the right rhythm. For every minute of CPR that is delayed, their chance of survival drops 10%. If you have immediate CPR, that doubles or triples their chance of survival. So CPR is so important. If you have not gotten it yet in this class, then you will be getting it before you start clinicals. The chain of survival. In hospital cardiac arrest, this means recognizing the cardiac arrest is happening and activating the emergency response system. There is immediate high-quality CPR that will be started, rapid defibrillation, which is using the defibrillator if needed, basic and advanced emergency medical services, advanced life support and post-cardiac arrest care, and then recovery. Now let's talk about personal wellness at the end. It is not just about what you eat. It requires a holistic approach, one that meets the physical, emotional, social, spiritual, and economic needs to be able to stay healthy. This is the holistic food pyramid, where you used to just have breads, grains, fruits, vegetables, and meat. This one also includes your oils, your water, and all of the other holistic in the circle around it, like exercise and spiritual practices and so on. Proper nutrition. Plant-based diet that is rich in a variety of vegetables, vegetables, fruits, and legumes. You want to avoid processed, starchy staple foods. Balance your carbs, fats, your proteins, your vitamins, your minerals, and your fibers. Balance that all out. Rest and exercise. We already talked about this, but lack of rest and sleep can lead to fatigue and even medical problems. So you want to try to get as much rest as possible and decrease your stress. Stay fit to be healthier and live longer. Focus on strength, flexibility, and endurance. Personal hygiene. Shower and bathe regularly. Use deodorant always. but no heavily scented lotions or colognes in the hospital setting. Brush your teeth and use mouthwash several times per day. Clean your hair and make sure it's neat. Have your fingernails clean, short, neatly trimmed. You cannot have artificial or acrylic nails in the most hospital or clinic settings. If you have them now in the program, you will need to have those removed by the time you go to clinical. Back protection. Use proper lifting techniques. Bend at the knees. Use your legs instead of just your back when you're picking things up that are heavy. Stress management. Chronic stress weakens your immune system. It's also associated with hypertension, which is high blood pressure, ulcers, migraines, and nervous breakdowns. So make sure you, if at all possible, try to manage your stress. Okay, lastly, these are the competencies that were met in this chapter. If you have any questions, as always, feel free to email or message me, or we can talk about it when we see each other in person. See you next time.